It's been a minute. It's been a minute. Work has kept me busy. Happy holidays. Hope you had a great Christmas. I worked at the hospital over the Christmas weekend. Did five five in a row. Off today. Back I should say I was off yesterday, back tonight. For a couple more days, it has been busy. A little slowdown in the market, but I did want to touch on something that I often hear people talk about. So I've been a nurse. I've been in healthcare for about 10 years now, a little over 10 years. And when I worked as an aide, so originally I had my own business. I worked in swimming pools and jacuzzis, and I typically did, installations, repairs, openings, closings, etc. It was typically what I did to earn a living back from my early teenage years on. So when I made the switch to healthcare, I noticed something really quick was that especially the area where I worked on a subacute vent unit when I first started in healthcare. And one thing that I learned really quickly about the healthcare system, you ever see like these vampire movies where they have people like in warehouses. I think it was in the movie Blade, where they have all these people like basically stored in warehouses, and they're just like bleeding the people dry for their blood. They're basically cows, right? They're just basically milking them. And so if you've worked in healthcare long enough, you will come across many elderly patients that from the healthcare business perspective are just like that. See, in America, because a lot of medical expenses are socialized, they're just basically dumped on the shoulders of other individuals. So from a personal perspective, experience, you don't have to pay for that person to be on a vent. You don't have to pay for the person to get that peg placed in, because that gets socialized among everybody, right? So that it gets distributed among everybody. Everybody else has to bear the weight of these individuals in terms of the cost. So if someone were to say, well, if you were to make this choice, it's going to cost X amount of thousands of dollars or so. And that's one of the reasons why healthcare is so expensive, is because you don't see the bill, you don't get the bill. So they can just dump that bill on top of the shoulders of the taxpayers. And that's why one of the reasons why medical expenses continue to go up. The other thing is that if I had to make a choice about this particular medical procedure for my family member or for an individual, it might cause me to rethink the whole situation about whether financially this burden is worth it over the long haul. Especially, I have to take into consideration the quality of life versus the quantity of life that said procedure would offer to that person. But since none of that is basically dumped upon the shoulders of many individuals, a lot of that gets socialized to the American people through the healthcare system. So from the healthcare system perspective, they don't mind a lot of these patients, because they just, in essence, they just milk them. They just milk the taxpayer for this money. I mean, I see this all the time where, a patient comes in, they have pneumonia, they get discharged a little too early for whatever reason, because they got to get them back to the nursing home before the patient loses the bed, or because the insurance company only allots X amount of days for specific reasons that the person came into the hospital, and so they discharge them back to wherever they came from, whether it's home, the nursing home, whatever, wherever they came from. And so what happens is that person eventually makes their round back to the hospital within, a few days or a week, but they come in for a different reason. So the person came in for chest pain and they were discharged a little too early, and then now they come in for shortness of breath. And of course, if you have cardiac problems, you're gonna have shortness of breath, or they come in for like elevated troponin, or they'll come in for chest pressure, right? So they just change the wording of why they came into the hospital, because they can't come in for the same reason, right? So they just changed the wording of why they came in, but it's all related to the same initial problem that brought them into the facility, right? This is how hospitals skirt laws, basically. And then they, of course, give this back to the American people and say, pay this bill, right? So this happens routinely. So the person here makes this comment, 1 in 10 South Dakota nursing home residents have died due to your callous indifference, which you've cloaked in patriotism. So they had lives, they had families, they had value. And I would say they did. They did have numerical value in terms of a dollar value for the hospital. and but not necessarily in terms of emotional value for the people. Sure, I can't tell you how many patients that I come across, especially many of these elderly patients, where it's almost borderline criminal that they keep some of these people alive. And of course, it's because the family doesn't want to let go, right? And that's one of the things, one of the reasons why I tell everybody who's gets a little bit older, and I advocate for them to put in writing what you want done for you and give it to your local hospital, give it to your local doctor, so that a lot of these procedures that people put you through in terms of end of life, you don't have to go through. I mean, especially if you as a patient come into like a teaching hospital, you're just the guinea pig, right? They just run procedures on you. I mean, I cannot tell you how many times where from my experience as a nurse, and I look at some of these patients and I'm like, this is borderline criminal, keeping these patients alive, where they're cancer ridden. The patients, the quality of life, there's zero quality of life, but there's intervention after intervention to keep these people alive. And of course, one, it's because of the family. Two, it's of course these individuals, like I said, they just get milked. They get milked from the taxpayer, hundreds and hundreds and hundreds of thousands of dollars, for procedures and for hospital stays. I mean, it's literally borderline criminal. And if you like, from a moral perspective, we are like more humane towards animals than we are towards people. We see an animal in distress, we recognize that there's no quality of life left for this animal, and we will do the right thing and we'll euthanize those animals because we realize that these animals are suffering. We act more humane towards animals than we do towards one another. And of course, it's primarily because from a business perspective, like a business, if the animal treatments are not socialized. So when the doctor says, do you want to do this sort of treatment for your dog or for your cat? They'll be like, it costs, X amount of thousands of dollars. You realize, one, that's too expensive for you to bear the burden. Two, you realize it's not really going to do anything for the animal over the longevity of its life. It's basically lived out. I shouldn't say, I'm not thinking usefulness, but it's lived out the most quality of life that it could have. And the right thing to do is to put the animal down, unfortunately. We do that with all different types of animals, whether it's cat, dogs, horses, etc. As they say, we put them out to pasture. But with humans, I mean, they don't do that. I mean, at least put the patient on hospice, right? But again, this is something that is offered to the people. Of course, get pushed. Oh, we can put a peg tube in. That's not a problem. We can put them on a ventilator. We can do all these different things, but they don't talk about the quality of the life that that person will have. It's one of the reasons why most of the time when I work in healthcare, I don't see family members. I don't see a lot of family members come and visit these patients, because every time when they come in, it's always a very sad experience because they look at the individual. Most people don't want to see their loved ones in that sort of situation where they're tied up to all these different tubes and machines, basically keeping them alive. But this is what often people do. It's often what they do to their loved one. It's very sad and unfortunate. Not something I would want for myself or anybody in my family, but everybody, of course, makes their own decision. But this person right here talking about jobs that can be replaced, but people cannot. Like the quality of life that this person is talking about is often painful for many of these individuals and a very sad experience. And the Bible actually talked about the Bible talked about these specific years when people have grown old. In the book of Ecclesiastes, in the very first chapter. And this is something that many individuals don't even take to heart. Many individuals don't even think about what their later years will look like. And it goes on to say, it says, remember your Creator in the days of your youth, before the days of adversity come, and the years approach of which you will say, I find no pleasure in them. And these are typically the years where people find no pleasure, that we want to extend people's lives, where most of these years are not filled with joy and with pleasure. They're typically filled with one doctor visit after another, one hospital visit after another, one bed sore after another, one medical procedure, one surgical intervention to keep these individuals alive. Instead of allowing people to have the majority of their youthful years being filled with pleasure and with joy, unfortunately, we try to leave that towards the end, extending people's lives unnecessarily. And so to sit here and to advocate as if you're doing a favor to many of these older individuals, by and large, is not really what's going on. Many of these individuals are in pain. They're left alone within nursing homes, in hospital beds, left typically to die alone. Regardless of the pandemic, most of these patients that I have cared for typically die alone. It's very rare. It's very rare where I will come across families that are actually there when the patient expires. Most of the time, we're contacting the family members to let them know that the individual expired. So this whole argument about all these people dying alone because of COVID, believe me, most of these patients were dying alone even prior to that. And it's because most family members really don't want to be in this environment seeing their loved ones that sick. This is the unfortunate reality of the American healthcare system.